Hi, this is Joseph with TouchSense and on Twitter at Signal Somatics. I wanted to take a few minutes to talk about where manual therapy or manual therapeutics fit into the rehabilitative process. Rehabilitation in general is exercise based, and usually manual therapeutics are just an add on in the average rehabilitation clinic. So it's not really highly specialized frequently. It's becoming more so because of the results that are possible, and especially for someone who is sensitive in the sense that they care about their patients. Uh, they when you see that someone can get better results or alleviate the pain of another, help alleviate the pain of another. That's they're having the experience, so you're not taking it from them, but you can help them raise the threshold of their capacity. Their capacity improves, and what's most important is the amount of compensation that they're generating while they perform any given activity is reduced. And this is done by treating, if not the most important area, one of the more important areas. In other words, you're not just saying, oh, the knee doesn't flex, let's stretch the knee. We ask another question and we say, what else might be inhibiting the knee from flexing? And you ask it, you can ask that question mentally, and you really ask the body, and you really feel the body. You ask the question through the body, and you listen to the response through the body. And that's where you'll get the answer to that question. You'll be directed, so to speak. You'll find through palpation, through tension. You track through the tension, the compensatory pattern. The compensatory pattern demonstrates itself as a tension. You track that into the more key site of injury, the more problematic site. When you treat that, a lot of that compensatory patterning just goes away. I saw a young man a couple weeks ago, a football player, defensive end, 20 years old. He's just here on summer break, and he had some headaches, neck tension, low back pain, and also complained or said, my posterior chain, he literally said that. Of course, he was familiar with training and rehabilitation. He said, just my whole backside, my whole posterior chain is really tight, and it wasn't always like that. I asked my coach about it, he said, and the coach said that that was part of getting stronger and more explosive. I know what he's trying to point to, that, as we really demand, we're doing a lot of deadlifts or squats, you're going to create a lot of tension in those muscles. The more tension we create, we have to really work to keep them relaxed, or we have to work to allow them to relax after the demand. So I'm pointing that out to say that we get things. So here we're just asking this athlete to push through it, essentially. Don't worry about it. Keep going, and you're going to be a great football player. Is the model. I'd say you're being more set up to probably greater injury because you can't relax the posterior chain. And why is that? Well, he had a concussion, and probably some other, would doubtless some other impacts. But what he had in straight leg flexion, was very limited. I don't know, maybe 65, 70 degrees or something for this 20-year-old college athlete. That's not really flexible. So we tracked it, circulation. When we treated that, he was back at 90 within, I don't know, whatever it was, 20 minutes or so. He definitely noticed his posterior chain being much more flexible when we were done with the session. I did see him a second time, a week later or whatever it was, for the concussion, and and treated his neck and cranial system separately, just due to time constraints. And he had a very good response. But it points to, and now he'll hopefully will be. And we talked about having good movement, because he's going to have to take that back with him. He's going to be in the gym. He's going to be playing football. But to the point that it's July now. I saw him a few weeks ago, so it was maybe June something. Well, that's fall sport. If you make it to the playoffs, usually you're playing on Thanksgiving, American Thanksgiving. So by by December you're done. So that's been 7 months, 8 months he's been out, depending on how well they did, and he still was having tension 7, 8 months later, and he's training. So it wasn't going to just go away. He was highly compensated physically. The compensation that he was generating in his body was high. So when you remove those core tensions, we don't have to work as hard. Our nervous system doesn't have to manage as much, because we're not compensating for as much. So that's kind of the key point I wanted to get across. I think I'll stop there.